Before we do anything else today, let's do a very simple men's health self-check. In the next 30 seconds, you're going to get a quick snapshot of whether the bladder changes you've been noticing sound more like normal aging, common urinary irritation, or whether they may deserve a closer medical look. No panic, no complicated language, no guessing, just honest answers. If you are over 60, this conversation matters more than many men realize, because bladder cancer warning signs often do not arrive in the dramatic way people expect. They do not always begin with severe pain. They do not always knock you flat. And they do not always look obviously different from the kinds of bathroom changes older men blame on age, prostate enlargement, or a sensitive bladder. That is exactly why men delay. The symptoms feel familiar enough to ignore, but serious enough that delay can cost you clarity. I'm Dr. James Whitaker, and here is how this works. You are starting with a perfect score of 7 points. I'm going to describe 7 warning patterns. For each one that applies to you, subtract 1 point. At the end, you'll have a clearer sense of whether you may be brushing off bladder warning signs a little too easily. And stay with me until the end, because the #1 mistake older men make with bladder cancer is waiting for the pattern to become dramatic before they take it seriously. Let's begin. You start with 7 points. Number 1. Have you seen blood in your urine even once and told yourself it was probably nothing? If yes, subtract 1 point. Number 2. Have you been going to the bathroom more often than you used to during the day or night and blamed it only on getting older? If yes, subtract 1 point. Number 3. Have you felt more urgency, like you need to go quickly even when your bladder is not that full? If yes, subtract 1 point. Number 4. Have you noticed burning or pain with urination and assumed it had to be just irritation or infection? If yes, subtract 1 point. Number 5. Have you had trouble urinating, a weaker stream, or trouble starting, and assumed it must be only prostate enlargement? If yes, subtract 1 point. Number 6. Have you had back pain, especially low back pain on one side, and never connected it to urinary changes? If yes, subtract 1 point. Number 7. Have you been telling yourself, these are just normal aging bladder changes, without stepping back to look at the whole pattern? If yes, subtract your final point. Now look at your number. If you scored 6 or 7, that is a stronger starting point. You may not be showing many obvious warning patterns right now, and that is good news. If you scored 4 to 5, your body may be sending mixed signals. That does not automatically mean cancer, but it does mean you should stop automatically calling these changes normal aging. If you scored 3 or lower, please do not panic and please do not shut down. The goal today is not fear, it is clarity. Go ahead and write your score in the comments. I'd also like to know your age, where you're watching from, and which symptom bothers you most right now. Is it blood in the urine, nighttime urination, urgency, burning, weak stream, back pain? Save your score, because we're coming back to it. Now let me give you 1 minute of simple science. Mayo Clinic says bladder cancer symptoms may include blood in the urine, frequent urination, painful urination, and back pain. It also says bladder cancer risk increases with age, is more common in men, and is more likely in smokers, who are about 3 times more likely to develop it. The American Cancer Society says blood in the urine is most often the first sign of bladder cancer. It also says the blood may not show up every day, may go away and come back, and that early bladder cancer often causes bleeding with little or no pain or other symptoms. The same page says bladder cancer can also cause frequent urination. Cleveland Clinic says bladder cancer typically affects people age 55 and older and notes that blood in the urine is the first and most important symptom many people notice. NIDDK also says blood in the urine can come from many causes, including infection, stones, BPH, and cancer of the bladder, kidney, or prostate, which is exactly why guessing is such a poor strategy. That is the hidden problem older men run into. The warning signs often overlap with common explanations. So instead of asking, do I have one symptom that proves this is cancer? Doctors ask, what pattern are these changes forming? So now let's count down the 3 biggest messages your body may be sending when bladder cancer warning signs are being mistaken for normal aging. We're going from number 3 to number 1, and number 1 is the one older men dismiss the longest. Number 3 is this: common bathroom changes are still changes. This is where many older men lose months and sometimes longer. A man starts getting up more at night. His bathroom trips become more frequent. He feels more urgency. Maybe there is a little burning now and then. Maybe the stream feels weaker. But because these are common complaints in older men, he stops seeing them as information. He starts seeing them as background noise. That is dangerous thinking. The American Cancer Society says bladder cancer can cause more frequent urination, urgency, pain, or burning during urination. Those are exactly the kinds of symptoms older men often explain away as aging or enlarged prostate. Here is how to think about this more clearly. A symptom does not become meaningless just because it is common. In older men, the real question is not whether a symptom is common. The real question is whether it is new, worsening, recurring, or joining other symptoms in a pattern. What should you notice? Direction. Are things stable? Or are they changing? Are you going more often, more urgently, more often at night? Is the stream weaker than it used to be? Are you starting to build your day around bathrooms? Why does this matter? Because bladder cancer warning signs often hide inside symptoms men have already normalized. The most common mistake is saying, "A lot of men my age deal with this," instead of asking, "Why is my pattern changing now?" If you need an easier version of this check, ask yourself one question this week. Is this truly normal for me, or has my bladder story changed? That question alone can catch what denial misses. Number 2 is this. Overlap creates false reassurance. This is where older men get trapped between possibilities. Bladder cancer symptoms can overlap with urinary tract infection, bladder irritation, overactive bladder, and enlarged prostate. That overlap confuses people. They assume the more common explanation must be the correct one. If they already have prostate trouble, they blame the prostate. If they have urgency or burning, they blame irritation. If they are over 60, they blame age. But overlap does not equal safety. NIDDK says blood in the urine can have many causes, including infection, stones, trauma, BPH, and cancer. The American Cancer Society says the same symptom pattern that can look like an infection or enlarged prostate can also appear with bladder cancer. That is why doctors do not let familiarity make the decision for them. Here is how to think about this more clearly. Overlap should make you more careful, not less careful. If several conditions can create similar symptoms, that does not give you permission to guess. It gives you a reason to stop guessing. What should you notice? Whether you are using one familiar explanation to cancel out the rest of the story. For example, I have a weak stream, so it must be my prostate. Or, I go a lot at night, so it must be age. Or, I had burning once, so the blood must be an infection. Why does this matter? Because serious conditions are often missed when men feel too reassured by a symptom that has a harmless explanation. The most common mistake is assuming the most familiar answer is automatically the right answer. If you need an easier version, remember this. Overlap is not reassurance. Overlap is exactly why proper evaluation matters. And before we move to number 1, if this video is helping you understand your body more clearly, take a moment to like the video and subscribe to American Urologist. It helps me reach more older men who may be quietly normalizing warning signs they should at least understand better. And if you've made it this far, let me know in the comments which symptom men over 60 dismiss the fastest. Now let's get to number 1. Number 1 is this. Blood in the urine is the warning sign older men explain away in the most dangerous ways. This is the big one. Some men see it once and decide it must have been nothing. Some see it and assume it came from strain, dehydration, prostate trouble, or irritation. Some feel relieved when it goes away, but this is not how doctors think. The American Cancer Society says blood in the urine is most often the first sign of bladder cancer. It also says the blood may not be visible every day and may go away and return later. Usually, early bladder cancer causes bleeding with little or no pain or other symptoms. Mayo Clinic also lists blood in the urine as one of the main symptoms people should get checked. That means the very thing older men use to reassure themselves may actually be part of the reason the warning sign gets missed. There was no dramatic emergency, so the man tells himself the problem must be gone. But painless intermittent blood is not a reason to relax. In older men, it is one of the clearest reasons to stop dismissing the pattern. Here is how to think about it more clearly. If bladder changes are the background noise older men normalize, blood in the urine is the red flag they rationalize away. And because it can come and go, many men give themselves false reassurance right when they should be paying closer attention. What should you notice? Any visible blood, even if it was once, even if it stopped, even if you felt fine, even if you thought there had to be some innocent explanation. Why does this matter? Because early bladder cancer may not give you pain, weight loss, or dramatic illness. It may simply give you blood. The most common mistake is thinking, if it were serious, it would keep happening or hurt more. If you need an easier version, remember this. Blood in the urine is not normal aging. It is a symptom that deserves a reason. Now let me give you 3 daily boosters that can help older men think more clearly about bladder warning signs. First, track patterns, not isolated symptoms. One weak stream by itself may not tell you much, but weak stream plus urgency plus nighttime urination plus blood in the urine tells a very different story. Second, stop using age as a diagnosis. Age can increase risk, but age does not explain away symptoms. I'm older now is not a medical conclusion. Third, pay special attention to what is new, worsening, or returning. The body often whispers before it shouts. If your bladder habits are changing, That change itself is information. Now let's close the loop. Think back to your starting score. If you scored low today, do not let that uncertainty just fade into the background again. Recheck yourself in 2 weeks if you've been monitoring symptoms and your clinician has already given you a plan. But if you are seeing blood in the urine, if your bathroom pattern is changing, if symptoms are piling up, or if you keep calling everything just aging, that is your sign to stop normalizing and start paying attention. Today, we talked about bladder cancer warning signs older men mistake for normal aging. We looked at how frequent urination, urgency, burning, weak stream, nighttime urination, and back pain can overlap with more common explanations. We also talked about the biggest warning sign of all, blood in the urine, which may come and go and may show up with little or no pain. And we talked about the biggest truth of all. Doctors do not dismiss these symptoms just because they are common in older men. They look at the pattern. This is not about panic. It is about refusing to let familiarity blind you. The symptom older men see every day is often the symptom they respect the least, and that is exactly why understanding the pattern matters. Your urinary health matters. Your bladder health matters. And if your body is changing, the goal is not to guess better. The goal is to stop ignoring what deserves a closer look. If this video helped you, share it with another man over 60 who needs to hear it. And if you want to keep going, watch the next video on your screen, where I'll break down when blood in the urine becomes a true emergency and what doctors look for. I'm Dr. James Whitaker. Stay informed, stay steady, and I'll see you in the next one.